right, well, this is an exciting session too. So let's see, we have lots of return participants, so that's a good thing. So let me launch the beginning of the next second half of the afternoon. And first, I would like to invite Dottie Watson with Grand Rounds to talk about Grand Rounds advocacy and navigation solutions and give us a little showcase. And first of all, thank you, Dottie, for your support for our forum this year. It's very, very wonderful that you do that. So with that, Dottie, it's all yours.
Awesome. Thank you so much, Mary Ann. We appreciate being included. And if you'll go to the next slide. As typical for Grand Rounds, we have something new to talk about this year. We are a company with innovation in our DNA, and our mission continues to be the same as it always has been, and that is to raise the standard of healthcare for everyone, everywhere. And this year, we also were fortunate in 2020 to receive a $175 million investment from the Carlyle Group, who believes so strongly in what we're doing and wants to be a part of that. Most of you probably know Grand Rounds as our initial foray into the healthcare with our expert medical opinion. And we really worked from the premise and started our company from the premise that healthcare was really broken. And it was going to be our mission to really make it an experience that members could easily navigate with support and get to the right care and get to high quality care. And so while expert medical opinion has been our first product that we launched, we subsequently have launched concierge referrals. We're fully into navigation and have been for the last 4 years. And this year you're going to hear about our latest product release, which is virtual care. And it's been the topic of the prior conversations that we've had today. So we're excited to share with you our virtual primary care and virtual care model that was released back in April of this year. Not only are we an innovator and a leader from a navigation and healthcare space, but we're also viewed and also outreach to from as a reliable source to advise and to give other entities sort of the pulse of what's happening in healthcare and how we're transforming it every day as we go to work. If you'll go to the next slide. Specifically, the three services that we offer, the three product sets that we offer include expert medical opinion, which we spoke about just a minute ago, navigation and advocacy, and the topic today around virtual primary care and really returning to care and how virtual primary care will have a significant role for the return to care. And guiding members to the right place, reducing costs and improving outcomes is really the focus of everything that we do for our employers and their members. And if you go to the next slide, I think the best way to illustrate it is really in a case study. This customer is has a nationwide footprint as a retailer. They've been a customer of ours for over 3 years. And the problem that they were trying to solve really was to find a way, despite having tools for provider search and transparency, they still had a population of 39% of high cost members that either had no PCP or they had very low quality primary care, and they weren't sure where to go for care. The members frequented the emergency department, and they had 41% higher cost in some geographies. And so we did a pilot, we were doing a pilot with them in the Carolinas, and we're Grand Rounds in our Connected Care program, which was released in January, really focuses on a longitudinal experience for every member. And it really is the replacement, if you will, for the sort of old-timey or the existing programs that are in place of care, case, and disease management. The employer wanted to have an embedded solution within the navigation so that we could bring to bear all of the services and the benefits that they had in their ecosystem. And some of the key results are for the early results include the baseline was 1.7% of members were engaged in their care management program. Grand Rounds grew that engagement through targeted outreach and other ways of engaging the population to 2 times that. They had a base of 39% of members who did not have a PCP or had a very low quality PCP, and we increased that year over year of 120% when new PCP matches. High ED utilization versus the rest of the company in the Carolinas, and we were able to reduce that 18.3%. And then a higher growth in spend per member versus the rest of the company. And we were able to reduce the trend by about 10%. Once again, early results, but significant results for this customer and the pilot population within the Carolinas, just as an example of what Grand Rounds does on a daily basis for our customers. And with that, I will turn it over to Lisa so she can introduce our exciting panel today.
Thank you, Dottie. Good afternoon, everybody. I'm Lisa Knowles with Celanese, and I'm happy to introduce the speakers for our next presentation on helping employees navigate their return to care. First of all, Gina Hanrahan is the Director of the North American Benefits at Salesforce, where she supports the strategy and implementation of benefit programs for employees in the US and Canada. Under the Camp Be Well brand, Gina is honored to support the 35,000 employees in their health and wellness journeys as they flourish in all aspects of their lives. Next, we have Dr. Todd Thames, and who is a family physician with more than 28 years of experience. He's been with Grand Rounds since August of 2016 and serves as a Senior Regional Medical Director based in San Antonio, Texas. He has a Bachelor of Science in Physical Therapy, a Doctor of Medicine degree at the University of Texas Medical Branch at Galveston, and also holds a Master of Science in Healthcare Administration from Trinity University in San Antonio. Throughout his 3 decades of experience, he has practiced full spectrum family medicine, taught in undergraduate and graduate medical education programs, including 5 years as a residency program director, and he served as a leader and administrator in both the ambulatory and inpatient hospital settings. Next, a veteran healthcare benefits executive, Mike Mateo, has a passion for working with clients to help solve some of the biggest problems in healthcare. As president at Grand Rounds, he is leading the customer-facing growth and client teams with satisfaction, cost effectiveness, and a healthy workforce being the key drivers for success. Most recently, Mike was the Chief Client Officer at Optum Rx as part of his 23-year career at United Health Group. He also held numerous executive positions, including CEO of the UHC National Accounts and Public Sector, as well as Optum's first Chief Growth Officer. So welcome everyone, and thanks so much. Take it away.
Appreciate it. Thanks very much. And if we want to roll forward to the next slide, I'm Mike Mateo, and we're thinking about a lot of different things in this session. So first of all, I think we want to understand about return to care, and then really think about a virtual strategy for care. And we've probably all heard a ton of things going on with the pandemic. We'll talk a little bit about that. We also want to hear and showcase what's going on from Salesforce to show just the fantastic strategy that they have implemented and the results that they've seen. So I'm really excited for Gina to share that with the audiences too. So kind of an aggressive agenda here, but I thought first we roll forward to the next slide, we can talk about what care looks like. And as we introduce the speakers here, myself, Dr. Todd, and others. And when you think about Grand Rounds, you can roll forward to the next slide, that'd be great. It's about our mission, and Donnie did a fantastic job talking about this, to raise the standard of healthcare for everyone, everywhere. And there's a reason for that. It's because I tell folks that if we sat down and we actually charged the brightest minds in academia, I think universities, college students, to put them on a project and said, please go out and design the most fragmented, complex healthcare system you could, they probably couldn't think of what we have today. And that's not an indictment of our healthcare system. People receive wonderful care. It's just that it hasn't advanced as a system as many other areas have. And that's the mission at Grand Rounds. I've been fortunate to be here for 6 months now after a rather long career, as introduced before, at United Health Group. But what I want folks to think about Grand Rounds is not as an individual product, but more of a platform. And the whole purpose is to become a personal healthcare assistant to help people in the most difficult times in their lives. When you think about it, all of us work in an industry and we interact with people, and it affects their health, their wealth, and their family. And very, very few products they consume do that. In addition to that, the system is so complex. When you think about it, maybe they interact in this very complex system a few times in their lives on their behalf of themselves or their family, maybe 5, 6 times, depending where you are. It is so complex, it's hard to master that. Everybody needs help getting through the system, and that's what Grand Rounds is here to do. The thing to think about now in terms of our pandemic, if we take a look at the next slide, is what customers expect of a company and an industry. And they look to us at Grand Rounds for many clinical solutions. And if we start to set up a discussion, and Dr. Todd will take us through a more in-depth discussion on return to care, there was this outbreak. There was simply widespread confusion about what is this? And I think we all just hoped it would go away quickly. I don't know how people felt, but we thought maybe it'd be over in a few months or so and something would happen. But there was confusion about, well, what's covered, what's not covered. We helped a lot of our employers through those discussions to think about it. The next became return to work. And many of us aren't back to work. I can see from the videos, most of us are kind of still in our home here, but there are a lot of companies that are back to work, and essential workers had to return. There are different risk assessments that are made. What do you do with testing? What type of testing, et cetera? And we spent a tremendous amount of time working with our customer base of over 130 customers on that. And then also this concept of return to care, because we all know what happened is that care decreased and people needed some essential care, which maybe they didn't get for the past 6 months or so during that time. And the return to care is very, very important to think about, not just what happened historically, but what is ahead of us. And as an industry, how are we going to help what I will assert to be this increase in care that's going to happen, or this catch up in care that's going to happen there. But if you start to think about Grand Rounds, those clinical solutions are at our root based on data and quality. And that's what reserves our talk on return to care. So I'm going to turn it over now to Dr. Todd to take us through his thoughts on return to care. And then we'll hear from Gina in a bit. And then I'll come back and talk a little bit about virtual care after that. Todd?
Great. Thank you, Mike. Certainly, as Mike alluded to, and if you go to the next slide, that'd be great. As Mike alluded to, healthcare is complex. And I think we can all pretty much agree that healthcare in the US is difficult to navigate even in normal times. Certainly, we saw during the pandemic that there was intense pressure on the healthcare delivery system. Patients were feeling it, providers were feeling it, we were all feeling it. This created, though, an inflection point in how we deliver care in the US, we believe. I think a few observations that are worth mentioning, specifically looking at COVID-19 as the catalyst, create some interesting opportunities to reshape the way healthcare is delivered. First off, access to care decreased during the early part of the pandemic, though primary care infrastructure was particularly stressed even previous to the pandemic. It became worse as we saw the pandemic unfold. And while we saw an acceleration and adoption of telemedicine, many doctors' offices and hospitals unfortunately closed altogether, or at least canceled a lot of the care that was planned that was non-emergent or deemed elective. Access to care dropped consistently across most major specialties, demonstrating the degree to which patients were feeling disruption. But by the numbers, what we saw in early April at the height of the stay-at-home orders were that ambulatory practices saw a decrease in visits by up to 60%, and in some cases even higher than that. Nearly half of the people that we polled, and nearly half of those that have been polled, about 48%, say that either they or someone in their household have deferred care due to the COVID-19 pandemic, with about 11% of those saying that the conditions that they struggle with worsened because of postponing care. Now, this disruption to primary care is particularly problematic because primary care is integral to the infrastructure of healthcare delivery in any given location. It controls long-term costs, it promotes clinical outcomes, it's vital to the way care is delivered. And further complicating this, it's estimated that about 30 to 50% of deferred medical care in 2020 will be postponed entirely, meaning that many employees, many patients are going to be caught in the middle and they're not going to be able to catch up on the care that they needed. The second point is that there was significant increase in uncertainty, specifically around how insurance was going to cover some of this care that was needed for the pandemic. So insurance coverage, as we all know, was already complicated from the perspective of the patient, difficult to understand. But in the spring and in the summer, patients didn't know what types of COVID-related care was going to be covered, testing, treatment, at what locations. COVID testing itself was covered in most cases, but patients received these bills that they weren't sure where they came from, in some cases for thousands of dollars, for COVID-related care that they didn't expect and that they didn't really want to have to pay. And that scared a lot of patients, quite honestly, from seeking care at all in the current condition. And then lastly, and very importantly, behavioral health needs spiked. Again, probably don't need to mention this in this setting. We all know it, we all feel it. But this spike was even beyond difficulty within the primary care infrastructure that was occurring previous to the pandemic. And this is really important to me as a primary care physician, because so often those physical conditions I'm trying to help patients manage coexist along with behavioral health issues that also need to be addressed. Virtual therapy and behavioral health solutions saw a huge surge in demand, anywhere from 25 to 65% in some cases, for those providers that were able to provide virtual care for behavioral health issues. And alongside this, about 68% of behavioral health needs are comorbid or exist at the same time with these physical conditions, and it makes it even more difficult to manage. And generally speaking, if you have a coexistent significant behavioral health issue with a physical issue, those patients are going to be more complicated, they're going to be harder to manage, and generally speaking, it's going to be more expensive to get the care they need as well. If you go to the next slide, what then does this new normal, or what we like to think of as the next normal, look like? Or what could it look like? So looking beyond just the headlines and into the data, there's three key trends that Grand Rounds is seeing. Number one, massive acceleration in the use and adoption of telehealth solutions. I think one thing that we've learned from the COVID-19 pandemic is a proof of concept that telemedicine can be delivered in ways that we hadn't necessarily thought about before. And that rapid spike in telehealth utilization seen early on in the pandemic has normalized to an extent, but it is not back down to where it was pre-pandemic. And so that tells us that there's adoption both from the providers and the patients. Members are returning to care, but that care looks a bit different than it did before. And telehealth is a great modality, but it is not reaching everyone equally. Adoption has lagged specifically in some of the lower income zip codes and in the rural parts of the country. And without intervention, this could exacerbate even current chronic challenges with these populations. If you go to the next slide, I think most of us are probably aware, but the curve itself demonstrates that telemedicine utilization grew by more than about 8,000% year on year in about April of 2020. In some cases, some health systems went from delivering 6 to 8% of their care via telemedicine to as much as 70% of their care via telemedicine. And so again, this gives us that there's this proof of concept of wide adoption of telehealth and virtual care services that we had not had before. The number of Americans reporting that they participated in at least one telehealth visit increased by 57%. And remarkably, those with chronic illnesses, it increased by as much as 77%. And that's important. I'll talk about it in just a second. When it continues to be, while it continues to be above the pre-pandemic level, significantly above the pre-pandemic level, we are seeing it drift back down towards more normal, although there's clearly an increased acceptance and adoption of virtual care. Now, of note, approximately 1/3 of provider organizations never even adopted telemedicine at all. And from April to September, many organizations have shifted back down from what was a very heavy use of telemedicine back down into more of a minimal use of telemedicine services. So on the next slide is something that I think is really important. And what we see here is that some of these changes in how telemedicine is being used. Prior to the pandemic, most telemedicine solutions and interactions were tele-urgent, if you will. You could be seen for your sore throat and you could quickly get good care through a tele-urgent visit. But getting the care for the chronic illnesses like diabetes and high blood pressure, getting your medications adjusted, those type things, those generally speaking continue to reside strongly in the in-person model and not so much in the realm of telemedicine. But that's beginning to change. And we're seeing and we're starting to note that these telemedicine visits used not only to manage tele-urgent issues, but also and increasingly to manage some of these long-term conditions. You can see by the examples that the shift through the claims data that we see through our book of business demonstrates this. In our data, we saw that the share of telemedicine visits for urgent issues like respiratory infections or acute mental health type problems as a proportion of telehealth utilization actually decreased, while those visits for chronic conditions like high blood pressure, diabetes, those conditions, visits increased tremendously. Treating long-term conditions like diabetes and arthritis requires, sometimes frequent interactions and frequent visits. And traditionally those visits have been in person. But this long-term shift toward leveraging virtual care to meet patient needs for these visits could be very powerful in terms of how we can address some of these major issues in care, and sort of reorient how we think about patient-centered care and meeting the patient where they are. Importantly, from our perspective, we've built out this approach to virtual care within the navigation platform that we've built. And importantly, we've used the Salesforce Health Cloud to build out a very robust product on our side that allows me as a primary care physician to have visibility on things that I didn't normally have visibility on when I was seeing patients in my clinic. So in some ways, and in fact, in many ways, it actually makes me more powerful as a primary care physician to have easy access to this information that I didn't necessarily have in my clinic. Now, if you look at the next slide, what we are seeing is that telemedicine, generally speaking, is being adopted for chronic conditions, and it's being adopted in areas where bandwidth is available. But we're also seeing what's being uncovered is some trends that are a little bit less encouraging. And specifically what we're seeing is that some members are still not taking advantage of virtual care as much as we would like for them to. And in fact, what we're seeing based upon an analysis of our own data is that rural members have been 36% less likely to receive virtual care for major chronic conditions. And it's hard to say whether this is providers in rural areas that just have been less likely to adopt telemedicine, or whether there are other factors that are impacting that. And it's also possible that this is just some byproduct of COVID that's been more acute than other factors. But even if we look back before the pandemic, you saw that there were these differences between rural access and urban access. And this could be a problem because a lot of these rural issues, or a lot of these rural locations are locations that could benefit most from having this modality of care delivered. Additionally, we see similar trends when we stratify members based on average household income by zip code. And so where members live in low income zip codes, we see about 46% less likely to receive virtual care. So again, this gives us an option to really target those type people and say, hey, we could really provide a beneficial service to those folks and help bridge some of that gap in equity around access for care for these folks using the virtual platform. So if you go to the next slide, what we see then is an opportunity. And although we're currently seeing an exacerbation of a lot of what are the access issues that existed before, the overall increase in telemedicine usage and the expansion of telemedicine for management of chronic conditions is a positive shift. It could potentially be a mechanism for addressing some of these health disparities in the long run and could offer patients a more patient-centric experience. So imagine people who were traditionally facing challenges like getting in-person care because of rural areas, or because of transportation issues, or because of the difficulty of taking time off work. Imagine those people that could now access care through this virtual platform, and we could even see broader applications for telemedicine service for those folks. So we have an opportunity to rethink virtual care and to evolve that care from the current sort of tele-urgent model into a more full person perspective, comprehensive, built upon the platform of navigation services within the context of how primary care can be delivered. And I believe that in doing that, we can create a new normal that actually can help bridge some of these disparities, and especially by providing virtual care through the infrastructure of the NAV platform that gives me the ability to see things that I hadn't seen before and leverage tools that I didn't have before. So if we go to the next slide, what I'd like to do is introduce Gina. I've dug in a bit into what the new normal could look like, and I'm going to pass it over to Gina so that she can talk about Salesforce helping their members navigate their return to care.
Thank you, Todd. Appreciate that. If you want to go to the next slide. Thank you. At Salesforce, we have a healthcare strategy, and our healthcare strategy is really built on 4 strategic anchors. The first strategic anchor is driving to quality. And this is our commitment to improving the health of our employees and their families, how we optimize healthcare delivery, and how we support the movement to both quality providers and quality vendors to help support overall optimal health for our employees. The second strategic anchor is optimizing access and design. This is our focus to how we understand and support employees' access to needed services, including how we build the actual plan design to support that access. The third anchor is improving the employee experience. This sounds simple, but as you all know, it's very challenging in execution. How do we create an exceptional employee experience and empower our employees to maximize the benefit programs offered? And last and certainly not least is investing wisely. This is where we focus on understanding our cost drivers, actively managing expenses, and then of course measuring performance to track the program successes of the benefit programs we offer. As we at Salesforce assess this framework, we found Grand Rounds to be really very closely aligned with our strategic anchors. The Grand Round solutions support quality, the foundation of quality in everything that they do. Quality is definitely a hallmark of Grand Rounds, and it's really been evidenced in all of our interactions with them. Clinical expertise. Their focus on clinical expertise drives the work they do with members, both on the front lines in terms of those personal interactions, but then also behind the scenes in the way they design and operate their products. That is very evident as well. A complete care experience. This is really kind of very similar to our employee experience anchor. Deep focus on the member experience and how they think about this experience holistically. And then also very important to us is the concept of innovation. Salesforce just is continuing to grow. Our needs continue to grow, and Salesforce has really found Grand Rounds to be a great partner to help us in terms of our innovation along the way. Next slide. So Salesforce, we started expert medical opinions with Grand Rounds in May 2017. That's when we launched the Expert Medical Opinion Program. At Salesforce, we have a social media site called Airing of Happiness, where employees can share various aspects of happiness regarding their work and their life. And we received many positive comments regarding Expert Medical Opinion Program, which created great visibility for us and the Grand Rounds program, us as benefit programs, and also with our leadership. So we began the partnership with Grand Rounds in terms of really obtaining significant partnership in terms of clinical expertise really outside the Expert Medical Opinion Program. As we continued with our strategy, we did in early 2018 through late 2018, we did a series of focus groups and global benefit surveys to really try to assess the various employee impacts and how they were assessing quality and obtaining quality services. And what we found out was really very concerning. It was very clear that our employees really were not able to appropriately navigate the opportunities to obtain quality care. And a lot of times really even had a hard time articulating what that quality care meant to them. So we began in early 2019 to develop a navigation support to really help support our members and their family members in obtaining the highest available healthcare services for, again, clinical optimization. We went through, worked on that in 2019, selected Grand Rounds in the fall of 2019, and in February 2020, we launched the navigation service. Again, we launched it in 2020, none too soon for this, as you know, March, the global pandemic was right around the corner. And so although we were really working in in-depth communication campaign to really communicate the value of Grand Rounds and the personal health assistance in February of 2020, we were able to very quickly pivot to the urgent response program that Grand Rounds offered in April 2020 to help support our employees, their family members, and also our managers and leaders in obtaining information, support, and resources to how to support our employees in the middle of the global pandemic. Next page. So has it worked? The answer is yes. We're really very pleased with our metrics thus far in 2020. 2020 has been a really long year. It seems like a long, long time ago we launched in February, but we're very pleased to show that we have had a 2 times return on investment in 2020. So again, really very positive. A lot of that was due to specialty medications, but there were also other types of change clinical opportunities to achieve those savings as well. We've also had 56% utilization in the first 8 months. Under the EMO, we knew that we were only getting a small percentage of the population. The prior year, we had 0.5% utilization with EMO. That has increased up to 56%, again, just in the first 8 months. And again, this is in the time where there's been a lot of deferred care. We've also, very important to us, has had a high satisfaction. Again, employee experience is really key to us, as I shared. And so we've had an 82% satisfaction with the care team, which was really much higher than our annual goal of 80%. We've also seen through our partnership the ongoing value of the Grand Rounds navigation services. We've gone ahead and seen how Grand Rounds has really been willing to partner with us to develop these programs to support the Salesforce Ohana. We've seen the impact and the focus on clinical expertise that they've demonstrated to our employees and our leadership. And then also very important during these times, their ability to measure and track the impact of the program. Again, really very, very important as we meet all of our objectives. Regarding just one more thing. Yeah, we did go ahead, just for some information, we did go ahead and utilize a multi-channel engagement and multi-phased approach. So what we did is for February launch, we really did a lot of focusing on the registration. So we really did through weekly raffles, through emails, banners, digital screens, all of these types of things. We, in January and February, really worked to go ahead to get our employees registered. And then once they were registered in February, we followed up in March with in-depth communications on the value of navigation and how employees and their families could benefit by contacting their personal healthcare assistant. Again, we were had no idea that when we were planning this last October and November, the value of really supporting employees in March with the personal healthcare assistant resource was really very helpful. Yes, and we are still working on our return to care strategy. When we take a look at our return to care strategy, we have a couple of things that we're really working on. One is access to the right care at the right time. This is really ensuring that our members do not delay getting necessary care, but also we don't want to drive employees into unnecessary utilization. Having the Grand Rounds expert medical opinion has really been critical to the effort, and having it baked into the navigation really provides member with additional resources and support to follow through in the expert's recommendation. And what we found, it's not just the expert recommendation that the employee values, it's the information and the confirmation that they're doing things the right way and obtaining the right information to really make sure that they fully understand not only their treatment options, but also the condition itself. We've also found Grand Rounds and work to help us in terms of navigate the healthcare system. Again, as I talked about, this provides personal health assistance. So employees have one place to go to get help. It's important for that solution to be nimble and flex and to be personalized. Obviously that helps with our employee experience, but also as our employees are young and they have moved all over the country into some not so familiar locales, having Grand Rounds to help support with various different navigation and provider search support is helpful as these employees are navigating some of their new working environments. And then the last is wraparound administrative financial support. Our employees have a lot of other things to worry about, and having additional challenges in administration and financial questions about how to navigate the healthcare system is just not something we want them to deal with. So again, Grand Rounds provides additional support to make the plan design really easy for our members and help support them to various different easy administrative and low-cost financial programs, such as early refills for maintenance, ability to support for a member who has a new specialty medication. Also just awareness of the no-cost, low-cost programs, such as mail order prescriptions and other types of telemedicine copays. So again, definitely ongoing journey that we are continuing to work to make sure that our employees have the opportunity to obtain the best possible clinical care available. Mike, do you want to go ahead and talk about the Grand Rounds vision for virtual care?
Appreciate it. And thanks not only for the presentation, sharing the information, but Gina, thanks for the partnership. Results like that aren't possible unless, as an employer or a leading employer, you develop programs that your employees can take advantage of. So really appreciate that. Before we jump there was a question in the chat too. I just wanted to bring up, someone asked a question, I think Todd, you did answer it, was around when we were engaging, do we use clinical pharmacists to make sure that patients get the prescription right the first time? And we certainly do. There are a number of clinical pharmacists that work not only with the providers that are there, but also with the patients to make sure that they get the prescription right the first time through that process. And so that's a very integral part of making sure that there are gaps in care there. As we start to talk about the future of navigation and telemedicine, Gina, what I love what you said was, it was really around, your people have a lot going on in their lives and they have a lot of things to do. And you know, maybe healthcare isn't first and foremost on their mind, or they're not interested in spending hours on the phone. And this is where we start to think about now the merging of navigation and telemedicine together. If we roll forward to the next slide and we start to think about that, Todd mentioned this a little bit in a couple builds are here, if you want to hit on those, that the tele-urgent solutions today, they're very valuable. People are interacting with them. They're getting the care that they need, but they're done in a very episodic fashion and not a full person care approach that's there. That's why it's really important to start thinking about what can we do in those longitudinal relationships. And so if you're having a great experience, you're interacting in a virtual environment, why stop there? People with chronic conditions of asthma or diabetes can develop a relationship in a virtual environment. And when you think about it, this virtual care has to not just replace in-person care, as it says at the top, but there's an opportunity to actually take it a step further and develop even more relationships and start thinking about social determinants of health. What's going on in that person's life outside of this acute episode they might be having that can help them manage their condition better. The other important part of this is leveraging all available resources. And if you're in a tele-urgent situation and you're acting there, that provider is doing the best that they can, but they're not aware of all the benefits that are available through the employer at that point in time. And there are tons of resources that are made available that can help address a person's condition or return them to health quicker. And the other aspect then is, how do you refer people to high quality specialists? And that's something that's very, very important to Grand Rounds, is when a person needs to go to the next level of care, make sure they're going to the right specialist, because as we all know, there could be a great orthopedic group, but that doesn't mean they're the that hips, knees, wrists, and everything else. And that's a big difference. Is quality is not measured at the group level in our approach to quality. It's measured at the individual physician level, and the ability to interact in a virtual primary care environment and then recommend and direct them to a high quality specialist is something that is very, very impactful as we start to think about this new world. If we think about the next slide and the timing of this, and the reason why we say the time is right to introduce this very new kind of healthcare experience for folks, it's not having a separation between a personal healthcare assistant navigating the system and a person treating you. It's time to really bring those things together. And you may ask, well, why is that time? There's a lot of reasons, but if you start to think about the effect of the pandemic, some recent studies show that as many as 8% of physician practices may close down. Another survey said 7% of PCPs thought they might not make it past December. That's a huge amount of care that has to be supplied someplace. Even before the pandemic, the projection that I saw was about 15,000 shortage in PCPs. Not many folks are coming out of medical school and going into primary care medicine at this point in time. And then across America, there's 82 million people that live in areas that are referred to as a health professional shortage. Many of us live in, I'll say, urban areas or close to urban areas where we can access the care. But as Todd showed, the care in rural areas where virtual care is not advancing fast enough is probably where it could have the best effect. And so you have to start thinking about all of those stats that come together. And we're doing this not just to create the experience, but in a way that has to drive three things. It has to improve the quality. And we know what improved quality will do. It'll bring down the cost in healthcare. And at the same time, achieve a high level of satisfaction. If you think about the results that Gina showed, even if we got all these people engaged, but they still weren't happy with the process, wouldn't achieve the goal, wouldn't achieve the aim that was there. And so start thinking about a world where we can interact in this whole person care that's there. Take a look at the next slide, and you start to think about one place where all care begins. So to peel it back a little bit more, there hasn't been one place where you can interact Because what happens is members don't know, and patients don't know, and employees don't know what is all available to them. No one wakes up and says, geez, I think I need an expert medical opinion. What happens is they get a diagnosis and they have all these concerns and they're dealing with their doctor. Now in one place, there's going to be the ability to not just understand the medical issues going on from a clinical perspective, but each and every part that's available to support them. Whether it's the claims and billing assistance they're going to need when these tremendous amount of EOBs arrive that create a tremendous stress level in people's lives, let's be honest, in terms of trying to understand what's there. The first questions become, what are my treatment options and who should I get treated by? That's what this virtual concept has done for Grand Rounds and will continue to do as we enter more of the virtual care environment. It also has an ability to identify and connect people to benefits. We are not a disease management company. And so as many employers, if you're listening on the phone, you've curated fantastic benefits for your employees. And I would imagine one of the biggest issues, how do I get people to use them more? How do I make them aware of them beyond just something in open enrollment and newsletters that are there? This is the perfect opportunity. You're interacting with your clinician. You're having a visit virtually, like we may be talking on the phone here or through video. And then that person will have the knowledge to direct you toward the resources that your employers put for you. That doesn't happen a lot in actually a physical office visit today. So those are some of the ways that can be very, very different in how we think about it. I talked a little bit about the chronic, but there's also those who have very, very acute care. And that's where they'll need help going through a process, and they're probably going in for a longer hospitalization. And they'll need help with discharge planning and a full case management. That's also available, that's there. Another key piece is to think about meeting the person, the whole person care is around behavioral health and telespecialty. And many times, as Todd mentioned, you're going to have comorbidities, and there certainly will be mental health issues that need to be addressed. And I think we all know there's an emerging crisis that's going to occur beyond the pandemic with mental health crisis. So now that's all in one place for people, and start thinking about that very different world. What it has to be is a simple framework, easy to use, that is in the daily flow for people, as easy as a phone call or click on their app. And that's what we're here to do. And that's what Grand Rounds has built, and we're continuing to build. Don't think it about as another layer or another obstacle that's there. It's actually a fully integrated system that'll help people achieve their goals and help employers achieve their goals that we talked about. If we think a little bit more on the next slide, this integrating offering is really taking what I described before as what could have been a confusing, frustrating, complex process, and now making it one that word frustration free. It'll never be frustration free if you get a diagnosis, but it'll be a place where you go for help. When I reflect upon the stories that I hear from Grand Rounds, the biggest one that I hear is really around, you gave me peace of mind. And I think Gina had referenced that in a few times, where people really feel good because they don't know if they're doing the right thing. And once they interact in this system, they're more confident in what is going to happen with them, to them. We also spend time supporting the family at the same time, because we all know you don't go through some of these issues in life one at a time. There's usually someone going apart with you, and we're helpful in bringing the entire family into this process. So whether you think it's primary care on a longitudinal basis, access to the greatest specialty care that you can get in a complex environment, or understand the behavioral health needs, that's a system that'll be built in terms of encounterment. And why is this so important? When I got to Grand Rounds, one of the things that was frankly shocking to me was that when someone goes through an expert medical opinion, the diagnosis or the treatment changes almost 2/3 of the time. That's not to say other people are bad or practicing bad medicine. It's to say the knowledge is there, and we have to democratize that knowledge throughout the healthcare system to help people make better choices through that process. So that is just one small fact. Now you start to think about higher utilization levels and higher input that we could start to affect more care that's over time. And so we are, as you can tell, very, very excited about this new platform that brings together navigation and virtual care at the same time. I refer to it sometimes as advanced primary care, or think about the best primary care visit you had. That's what we're trying to replicate here, and make sure people have all the information available that's to them. And so we're excited about it. And it's interesting that probably wouldn't be at this point had it not been for the pandemic. So when people say a return to normal, I say a new normal. Some people talk about. I actually hope we don't return to normal. I think there's an opportunity here to do something very, very different to address the needs of the population nationally, but particularly in some of the rural areas that might be out there in a way that may not have come for years had it not been for this rapid adoption of virtual care and the concepts we talked about in return to care and return to work. So with that as a discussion on virtual care, return to work, and a number of different things, why don't we open it up for some Q&A? If there are questions out there, we'd be happy to address them. So I don't know if the moderator, will people ask questions through the chat? Is probably how we'll get them.
You can use the chat box or the Q&A feature for questions. We do have one. Do you find incentives to include PCP attributions? If so, in what form?
Todd, you want to try to take that one? I'm trying to decipher the full question there. Do you use financial incentives to increase PCP attribution?
Not sure I understand.
Yeah.
I'm sorry, I'm not sure I understand the question. Would be happy to follow up with that question.
Or the context of it, yeah.
Well, I'll just jump in. You mentioned, I forget which one, mentioned about the telemedicine and some of the components of telemedicine, how people, employees, prefer to have kind of a long-term relationship with their own physician through the telemedicine, and that has changed dramatically just since COVID. To the primary care doctors are all doing it, and people can talk to their own physician virtually. I think that's a major step. But what about the telemedicine services that use physicians from many different places, specialists and primary care? How do you see that fitting into the whole scheme of things? For example, the grand rounds scheme of things, to have that in addition to or just separately from the primary care physicians that people already are using.
So I can sort of, I guess, address that, Marianne. Initially, certainly people are going to have conduits of care that come from different directions, just like they do now. So I think one of the big pieces for me as a primary care physician, what's foremost in my mind is this notion that I want to be, and I see myself playing the role of partner and quarterback for the patient. And so within that context, taking and assuming the role of an actual primary care physician is different than just engaging the physician in an acute visit. So as a PCP, leveraging this service through a virtual platform, I'm still holding myself accountable for all of what comes from this notion of being the patient's true partner and quarterback. And that means coordinating care. So whether that patient may be accessing care through other telehealth platforms or through local care, my goal is to be able to coordinate all of that, to have visibility on it. Our primary focus in building out the model that we are putting together is focused on making sure that we're integrated within the local network. So making sure that we have conduits of information flow between us and the local care that they may be providing. Certainly if they're also getting telemedicine services from other vendors, we could partner with that as well. My hope though is that if they're choosing a vendor, if they're choosing a place to get primary care virtually, then that really is their go-to location for the virtual care part of this. Certainly if they're seeing an orthopedic surgeon or a rheumatologist or a neurologist in their local community and that care happens to be rendered by telemedicine, that's, from my perspective, that's the same as getting care locally. So I'm going to interact with those local physicians the same way I would if I was seeing them in person.
Yeah. Can you talk a little bit more about any of you, about the access and mental health services and through the telebehavioral health and the kind of the whole person?
Yeah, well, and again, I'll be happy to speak to that, and then Mike, if or perhaps Gina from the employer perspective, if you have some thoughts. But certainly, you know, again, as a primary care physician, I don't necessarily. One of the interesting things about healthcare in America is that historically we have separated the brain from the human body, and we somehow treat mental health conditions as being separate from the biological organism that's carrying the brain around, which I find, you know, kind of nerve-wracking. But that has gotten a lot better. And so there is a real recognition of this absolute necessity at treating patients from the perspective of looking at what they're physically going through and also what the emotional and behavioral challenges are that they face. As a primary care physician in clinic, I actually find that I'm relatively limited in terms of what services I can access for my patients, trying to get them behavioral health or counseling. But what this whole virtual construct has opened up is there's some wonderful services available to patients through this virtual platform for behavioral health. We have our own integrated process, but there is also a whole, you know, collection and population of vendors out there that are doing really good work in the behavioral health space. And so my job as a primary care physician is to know about them and to connect my patients to those vendors. And so making sure that that connection happens, understanding the importance of that connection, and then importantly, tying that connection back into coordinated care is vital. It's vital in my mind. So Mike, I don't know if you had other thoughts around the notion of behavioral health from your perspective.
No, I think it's fantastic. And I love when Dr. Todd refers to us as biological organisms in the human body. That's there. But it's really a very unique way to begin to understand people and access mental health services that they probably couldn't have before. And really what we think about within mental health is a lot of the issues is access. You know, there are mental health providers that could provide care 24/7 and still have more people trying to go to them. And so having the way to do this virtually is actually a more efficient way to probably create interactions to help people understand how they might need to address some mental health issues and how they may be able to get ahead of it. I think all too often in mental health, we're treating the back end of things in time. And if we can get ahead of it and start to actually do a concept of kind of preventive mental health in a way to help people understand the stresses they might be under, we can probably get ahead of some issues that might manifest themselves in a physical way into the biological organism that's there.
Yeah, I think that just having the integration with the primary care is an ongoing challenge, but I think we're making headway in that space. We do have a couple other questions that came up in the chat box, and let's see. This one's for Gina. How should employers think about helping their employees connect the dots between in-person and virtual care? Hot on everyone's mind.
It is. And I think we think of it as, I guess, the same way we would think about making the connection between some of our core benefit programs and other supplemental programs, and how we utilize navigation to drive employees. So again, I think for us, the idea is to take a look at your personal health assistant and go to Grand Rounds, and then Grand Rounds can help ascertain the various different programs and services, which may be, as had indicated, a combination. It's not exclusively one or the other. It may be integrated between different types of care and different types of services at different times. So I think trying to think of them not as separate solutions, but just part of our overall benefit toolkit. I think that might, that would probably be the way we would want employees to be thinking about that.
Great. Here's a question that came in just a couple minutes ago for the panel, anyone. If some company already has a telemedicine solution that they're using or brought into, why would they need one integrated with navigation?
Yeah, I'll take that one first, Todd, if you want to jump on, or Gina at the end. The way I start to think about that is, most, as we discussed, the telemedicine solutions are in a tele-urgent capacity right now, and they're disconnected from the navigation system at this point in time. And so they don't really address gaps in care. They don't really set person on a new care journey. They may treat the episodic or urgent need that's in front of them, which is wonderful and convenient and should continue in some senses. But what happens when that provider has that interaction, discovers that that person might be pre-diabetic? Probably there's not going to be follow-up from that tele-urgent. If you're in a system that takes virtual care plus navigation, now you're in a position to start having conversations with the individual that can modify the behavior in the future. So that's just a little example about, and I struggle to find, is there a new word beyond telemedicine and navigation? That's a new concept that needs to be put forward so that people understand the longitudinal nature of it.
Yeah, the way I word that new concept, Mike, is truly patient-centered care. And so what that does is it puts me as a primary care physician sort of surrounded by an understanding of services that are available for the patient that I didn't actually have before. And what I mean by that is, you guys, Gina and her team spend an awful lot of time building out a robust benefits package for their employees that they want their employees to benefit from and take advantage of. But unfortunately, when I'm in my clinic seeing patients, I don't have visibility on that. I don't know what Salesforce or anybody else has built out for their employees. And so there's so many of those really nice benefits that I could leverage. But surfacing them for me, making me aware of them is a challenge. Within the construct of looking at telemedicine from the perspective of doing it through a navigation platform, it just equips me and arms me with more information about my patient that I can then leverage to help them get better using all these other services that they have available.
Employers are always looking to ensure that their employees are receiving high quality care or are doing business with being treated by a high quality provider. So this is for Mike probably, how should employers think about the provider quality and making sure that is provider quality when they're thinking about a digital or a virtual health solution? How can they ensure that?
I would suggest at first it should be one of the first things on their mind, because you can create access in a number of different ways, and you create access through high use of technology. But does that really solve the problem we're trying to solve, which is increasing quality and decreasing costs? And the exciting part about this is the way, and Gina had mentioned this, the way Grand Rounds was built was based off of quality. So we'll start this virtual visit. You're interacting with a high quality primary care physician that is going to go through the best processes that are there. And that individual has access to the data that says who's the next best high quality specialist for your particular condition. One other thing that's very, very different too is we won't recommend a primary care visit the same to everybody. So if 10 of us on this phone called in, and once we understand your background and your needs, if I have diabetes, I'm probably going to be matched to a different primary care physician than matched to someone else, if someone else has a different condition. And so it's a very dynamic and database way to inject quality and data into that process. And so it's probably one of the first questions that should be asked is, how is this process of recommending physicians, whether PCPs or specialists, going to be based in quality first? And cost is certainly a consideration, but not just a small town or network driven by cost. So.
That's good. That's a good answer. Do you think, maybe Todd, you know this answer. I know that as we talked about, the telemedicine is being just its usage. Your numbers that you showed were 8,000 visits or more just in such a short time. What do you think the longer term telemedicine adoption will ultimately be? I know during COVID, I bet you'll say it has something to do with reimbursement. So can you speak to that a little bit?
It has something to do with reimbursement. Yes. So, I think the proof of concept has been demonstrated, and it's not completely new. Telemedicine has been around for a long time. We need to stop thinking of it as a new modality, because it isn't, and that the folks that have been doing it have done a great job, and there's been a crafting of how to do this. I think ultimately the adoption of telemedicine is going to to be pretty robust, but variable. So if I'm in a situation where there are physical or logistical barriers to care for me getting care in person, then obviously I'm going to be more apt to do an adoption of something that's more convenient. And so I think if you look at some of these locations where getting care is a little bit more difficult, then it's obviously probably going to drive more interest, and I think ultimately adoption. But I also want to say that there's, you know, I do really good work when I'm sitting knee to knee to my patient as well. And so medicine is a very personal experience, and there's always going to be a component there that's going to need that connection. And so I think the notion is, how do we build the process out so that what we're providing for patients is extremely valuable within the context of what we can do through the modality, and ultimately what we can do through a virtual modality, we are learning, is much more than what we thought we could do. We can do a lot of really good, valuable work for patients in a virtual space. And then connecting that to the in-person care that's actually happening is important. I don't know that I could put a percentage adoption rate around virtual care. I think it's going to be highly variable, but I will certainly say, though, that your point is well taken. A lot of this has to do with what is the mechanism by which payment happens. And that's been one of the primary barriers, to be honest with you, up until now for wider adoption of telemedicine, is it's just, there hasn't been a great payment model as a mechanism to engage it. The catalyst of COVID had us leapfrog over that. And so now we've seen what can be done. So I don't look that we're going to fall back to the way things were. I agree with Mike. There's going to be a next normal that we establish. And so that's kind of my take on it.
Well, I think what COVID has done is created a springboard to, just new ways of delivering healthcare. And we talked about the new normal, even in our theme for this year's forum. And indeed, I think coming down just 2021 and beyond, there is definitely going to be a new normal of new possibilities and providing greater access and in a cost-effective way. And I know the cost-effective side is of great interest to employers. So I think there'll be a strong push to continue towards the telemedicine. Anyway, I want to thank all four of you, for your participation in this. Dottie, for your outstanding intro, and Mike and Todd and Gina. This was just a very informative discussion. Lots to think about, again, as all of these sessions are. They provide a lot of good food for thought. So thank you for doing this, participating in this. Thank you for sponsoring this forum. And what we'll do now is move on to the very last session of today,